Hi, my name's AnnaMarie. I am a librarian, a mother of one, and she has viral-induced asthma. My daughter was born premature at 28 weeks, and so her health at the start was quite dicey. From the age of about 10 months to about 22 months, we were in hospital quite often. She started off with bronchiolitis and then have respiratory issues whenever she became unwell. She also started daycare just after she had bronchiolitis, so being unwell was part and parcel of starting daycare. We were in hospital every couple of weeks with breathing issues, and with that came multiple courses of the liquid steroid Predmix. She was only quite small as well, so when she became unwell, she stopped eating as well, which compounded the weight issues. She also had chronic constipation at the same time, so all the courses of medication that she was getting didn't help that situation either. We were at the GP quite often as well. It was really hard to get some sort of long-term plan for every time that she became unwell. I mean, because I was the constant, I could see that every time she became unwell, she had respiratory issues quite quickly. The biggest challenges were the different guidelines and opinions across the health services. So at that time, 6 years ago, I know that the ambulance service had a different guideline as a Ventolin, so they wouldn't give it to young people, to young children. I know that the GPs, some of them thought that you couldn't get a diagnosis before 2. The hospital ran with that as well. There was only someone finally at the end, which was in the emergency at Sunshine, maybe on our 6th visit, that saw the history of us being admitted. We were there overnight a few times, in emergency, of course, and admitted for a day or 2 as well. That finally realised that it's not just the over 2 years of age, it's the constant reappearance of the symptoms that helped us get a diagnosis of asthma, viral-induced asthma, and then we got onto a preventer, which absolutely changed things for us. We were able to stay out of the hospital system from there. If she got unwell, I was able to manage it at home, to GPs every now and again. But yeah, it was a hard slog just to get that diagnosis, especially because of her age. Another challenging one was accessing the information and navigating the information, especially if English isn't your first language. It is for me, thankfully, but those in the community that don't have English as their first language, it would be almost near impossible to try and get your message across and kind of advocate for your child that we need some sort of longer term plan. There was really a lot of second guessing myself and helplessly. You felt really helpless, especially when she became unwell so often. And the only answer we were getting was the steroids from the GP, or even if we went into hospital, just to that short-term fix. One of the other challenges I think that we'll face, or families face, is the cost of the asthma equipment. I know that you can get a spacer and mask. Thankfully, we were lucky that we could get a spacer and mask, which from the hospital, that they're $20 to $40. It may not sound much, but if you are on a healthcare card or a limited income, those sort of things are quite expensive, especially if once you get your asthma plan, you have to provide that to the school or the before and after school. They all need a separate kit to go along with the asthma plan. So you have to provide 1 or 2. In my case, I have to provide 2, one to the before and after school care and one to the school themselves, and then one for myself that I have on hand, and also one to her dad as well. So we've got 4 just with us, just because. So if you think $20 to $40 by the 4, we're talking about $200, and that's before you think about the medication itself. And if you're not on a healthcare card, that can add up quite quickly. Some good things about the asthma services are the hospitals, GPs, nurses, and maternal child health. They all take it quite seriously, especially because it's respiratory. With hospital visits in the emergency, I didn't wait more than an hour on busy days as well, because it was a young baby with respiratory issues. So we were very lucky there. Same with the GPs, they made themselves available to help when she was having breathing issues. One of the biggest changes that I'd like to see is a consistent message across the different health services about what are the guidelines? What are the guidelines and how do we apply them in the different scenarios? Of course, we can't cover everything, but if the most important thing would be having the education and the information to the health professionals up to date. So some sort of accreditation or 6 monthly, yearly update that health professionals can access so that they're on top of everything. Okay, thanks.